Okay, so I'm BJ Miller, palliative care doc, and we are here to do the follow-up questions from our webinar this morning about medical decision making.
Okay, great. So one of the first questions is, how do patients and families begin to think about whether hospice is the right decision?
How do patients and families begin to think about whether hospice is the right decision?
Mm-hmm.
Well, first thing to note is that in general, most of the time, many people wait too long to start hospice. So when in doubt, it probably pays, if you're starting to think about it, it probably pays to at least talk to your doctor about the idea. Although talking to your doctor about the idea of hospice is a little bit fraught in that doctors are also terrible at prognosticating and knowing and thinking about hospice and aren't necessarily the greatest advocates for hospice, sometimes until it's very late. So one thing to consider, anytime you're even thinking about hospice down the road, is to find the local hospice agency. Most communities in the US now are serviced by at least one hospice agency. And by the way, hospice is not a federal organization per se. Hospice is an industry, it's a field. And so there are hundreds of hospice agencies, individual companies. So just because someone had one experience with a certain hospice agency, it could be a totally different experience with a different hospice agency. So but back to the idea, so as soon as you're even curious about it, I would call your local hospice agency, and if you have several, you might interview a couple of them, or at least ask around, get a word of mouth kind of feedback on people's experiences. But you can always ask for what's called an informational interview. Usually, in non-COVID times anyway, someone would come out, meet you at your house or wherever you're staying, and go over what hospice can and can't do and your eligibility, etc. So when in doubt, I'd always encourage that, even if the hospice idea is down the road, because then you have a sense of, you've met the folks, you have a sense of what to expect, you know who to call when it's time. Aside from that, the other things to consider with sort of weighing the odds of hospice or the timing of hospice, so if your goal is to be at home, if you know you want to avoid the hospital, if you know you're done with pursuing curative treatments, hospice is the way to get the most services into the home, and it's for the last 6 months of life, but people can recertify. Some folks are on hospice, depending on the situation, for more than a year. So, but if you know you want to be at home, if you know you're done with treatments, if there are no more treatments to offer you to cure your disease, or you're not interested in trying anymore, then it's a good time to reach out to hospice. The average length of stay is something like a couple months. The median length of stay is a couple weeks. So again, telling you you're late in the game. You qualify for these services for many, many months. And most people do very well on hospice. Again, it's the way to get the most services into the home, bar none. So, okay, there you go.
Great.
Oh, I guess one more thing. Hospice is covered by insurance. It is generally no out-of-pocket costs, no matter what your insurance status as a rule. So.
Great. And I will add something about my own experience with hospice as a family that brought it on way too late. When you, the caregiver, or you, someone who is kind of an outside caregiver, maybe who doesn't live in the home, if you're starting to just hear that things are changing, there was a fall today, there was something else that happened, that might be a good moment to bring someone in to do just an informational visit, like BJ said. You don't have to commit to anything. You'll just get a professional into the room who knows what to look for.
Yeah, great. Amen. And I guess this is such a juicy question. One more thing to say is, let's just say you go on hospice really early in your sort of end of life trajectory, and new treatments come along that you want to try, or you just don't like hospice, or you miss the hospital and that intensive acute kind of care scene, whatever it is, it's very easy to disenroll from hospice. And automatically, by law, your regular insurance kicks back in, and you will have lost nothing. So there again, when in doubt, probably a good idea to sign up for hospice, knowing you can always come off it if you want.
Yeah, I think that's an important point that people don't usually know about hospice. Related to that, the next question is prognosis an exact science?
No, absolutely not. Prognosis is not an exact science. Far from it. Prognosis is sort of averaged over the course of, thousands, hundreds of thousands of patients over a population, sort of watching various disease trajectories. So no, it is a generalized, averaged, gestalty kind of thing. Some of the more telling indicators for prognosis are things like, are you up and out of bed more than half the day? Um, Lots of weight loss despite, unexpected or undesired weight loss is another one. So there are certain things that a doctor can help sort of look at. And of course, the disease you're dealing with has its own trajectories. So you kind of find you deduce your way to a prognosis, and it's a best guess. And again, we're very often wrong. In general, doctors are over generous, so if a doctor says you might have, a year to live, very often it's much less than a year. Sometimes you'll hear stories about it. Someone was given a year to live and they lived a decade. So it's just all over the map. Use it as something to kind of get you in the ballpark. Don't treat it as gospel, but use it as a best guess so you can plan accordingly. But as with planning in most phases of life, especially in advanced illness, you plan, but you also know that you're going to make some real-time decisions depending how you're feeling, where you are, etc. So agility is the name of the game.
Great. Okay, and then the final follow-up question we had was, how do you counsel patients and caregivers when the preferences for treatment are in conflict? So maybe the patient and the caregiver are at odds about what to do.
So this is not uncommon where, this is sort of a team. Most of us don't go through this alone, right? So whether it's friends or family or professional caregivers, neighbors, whatever it is, churchgoers, whoever is our circle who might be helping, paid or otherwise. It is not uncommon for differences of opinion to creep in about what should happen next, specifically around treatment decisions. Knowing there is no one size fits all for treatments, this is very subjective stuff. What's right for one person may not be right for the next. So as expected with subjective stuff, they're going to have differences of opinions. So very common that a caregiver will think the patient should choose one thing and the patient feels otherwise. So when that happens, first of all, it's not a problem per se. It's people caring and having strongly held thoughts and feelings, and that's a good thing. But as always, the name here, the answer here is communication. So sometimes the patient and caregiver can just work it out between themselves. Very often, if there's an impasse there, then sitting with the clinical team can be very, very helpful. And just back and forth it and sort of think it through a couple different angles, talk about the trade-offs. And after a sort of a large group conversation that has sort of informed by the clinical science, et cetera, most of the time we can broker our way to an agreement. But sometimes you just got to agree to disagree. And in general, not always, in general, it is sort of the patient's wishes that trump, that is ultimately the arbiter of these kinds of decisions. But not necessarily. Sometimes the patient isn't really with it, and it's the caregiver needs who are really ruling the day. So, but when there is disagreement, no problem. Just plan on talking it out, getting more information, and using your clinical team to help you navigate and think it through.
Great. Okay. Thanks so much, BJ. Hope to see you guys at another one.
That's it. Okay. All right, guys. Thanks so much.